عليكم. برحب بحضراتكم جميعا في لقائنا الثاني سيمينار العلوم النفسية. زي ما حضراتكم عارفين سيمينارنا مميز مختلف. سيمينارنا ملخصات أبحاث حديثة، أحدث شيء اتنشر في الأبحاث في العلوم النفسية، ملخصات للأبحاث. سيمينارنا تدريبات، سيمينارنا ملخصات كتب، سيمينارنا إلقاء الضوء على بعض الموضوعات الهامة اللي على الساحة العلمية في مجال العلوم النفسية. مش محتاج ان انا اذكر حضراتكم ان احنا بنقدم كل ما هو جديد حديث مفيد في العلوم النفسية. اهلا بيكم، شرفتونا. بلاحظ ان بعض الناس عندهم مشكلات في دخول القاعة الصوتية. دكتورة سعاد ابو زيد، يا ريت حضرتك تراجعي الانترنت عندك، واضح انه في مشكلة. خلونا نبدأ بسرعة عشان عندنا حاجات كتير جدا اليوم. أول حاجة النهاردة هنتكلم فيها هو علم النفس المعرفي العصبي. يعني إيه علم النفس المعرفي العصبي؟ سؤال بيتبادر لذهن كتير من الناس اللي أول مرة يسمعوا الموضوع، وكمان المتخصصين في غير علم النفس المعرفي العصبي، والمتخصصين في العلوم العصبية، والمتخصصين في علم النفس المعرفي. خلونا نشوف الفيديو ونشوف إيه هو الأول علم العلوم العصبية أو أخصائي.
Meet Tim Brady. Tim owns a successful sports equipment business, and Tim, his wife Janelle, and the two kids are your typical happy-go-lucky family. At least that was until recently, when Tim was on his way to work, when he was blindsided by another car. Tim sustained a head injury during the crash, and since then, he hasn't felt like himself. He has been having headaches, difficulty concentrating, and he sometimes forgets to do important things at work and at home. His family and friends also notice that Tim seems a bit anxious, and his mood has been down since the accident. Tim's doctor believes that it would be helpful to get a better understanding of specific difficulties and what factors are contributing to them. So he refers Tim to see a neuropsychologist.
What's a psychologist?
A neuropsychologist. A neuropsychologist is a doctor who specializes in studying the relationship between everyday behaviors and the function and structure of the brain. Primary care doctors, neurologists, neurosurgeons, psychiatrists, and other specialists often call in a neuropsychologist when they want to assess a patient's brain function after a severe brain trauma or help make a particular diagnosis. An individual becomes a neuropsychologist by getting a PhD in clinical neuropsychology and undergoing additional training that provides him or her with the necessary tools to become an expert in understanding brain behavior relationships. A neuropsychologist can help doctors, patients, and families understand what factors contribute to a patient's complaints, what changes they might expect to experience over time, and what can be done to overcome certain difficulties. Neuropsychologists are experts in integrating and understanding all of the factors that could affect a patient. This includes cognitive abilities, mood and personality, medical conditions, and personal history, such as education and work experience. Neuropsychologists are also up to date on current research and are skilled in working with teams of other medical professionals. Let's go along with our buddy Tim as he experiences his first appointment with a neuropsychologist. It's normal to feel nervous about the appointment since it's unfamiliar. But don't worry, Tim. Neuropsychological assessments are non-invasive. So there's no needles, no pain, and none of those revealing hospital gowns. The purpose is to assess your brain functions, including both your strengths and your weaknesses, which can then be incorporated into making a diagnosis and help you develop your treatment plan. The assessment will start off with the neuropsychologist talking with you and your wife. He'll gather information about your medical, family, and personal history that can help him better understand how you function in day-to-day life. You'll then complete a neuropsychological testing. This will be mostly pencil and paper tests while you are seated at a table. These tests measure various brain functions such as reasoning, memory, attention, problem-solving ability, and many more. You might be wondering what happens after the assessment. Well, Tim, once you're done with the appointment, a neuropsychologist is able to use his specialized training to interpret your test results based upon your unique history. He uses these findings to make a specific diagnosis, which he can provide to the referring physician. And don't worry, Tim, the neuropsychologist doesn't stop helping you after the diagnosis is made. As a matter of fact, he is able to work with a wide array of other professionals to create a specialized treatment plan just for you. You will also be able to visit a neuropsychologist in the future for continued follow-up and consultation to see how your treatment plan is working out and if additional testing is needed. Well, now, looks like Tim has settled back into his day-to-day life as well. His wife and kids sure are grateful to have dear old dad back in full swing. Tim's grateful to have benefited so much from seeing a neuropsychologist, but he's also glad that he now knows about the many types of injuries, deficits, diseases, disorders, and other concerns that a neuropsychologist is uniquely qualified to work with. This bunch of Bradys now know that their brains will feel beautifully boisterous thanks to their friendly neighborhood clinical neuropsychologist.
أتمنى حضراتكم تكونوا استمتعتوا بالفيديو. الفيديو بيتكلم على النيوروسايكولوجيست وعلى الأخصائي العلوم العصبية وعلى الدور اللي بيقوم بيه وإزاي إن هو بيقدر يساعد الناس في التعرف على مشكلاتهم في إعادة التأهيل والعلاج، في التدخل العلاجي في كتير من الحالات اللي بتحتاج لتدخل دون جراحة، دون إبر، دون دخول للمستشفيات. يمكن الدور اللي بيقوم بيه أخصائي علم النفس المعرفي العصبي بيكون إضافي شوية. أخصائي علم النفس المعرفي العصبي بيربط بين القدرات الموجودة عند الإنسان زي القدرات العقلية، المعرفية، الإدراك، الانتباه، الذاكرة، التآني، التتابع، attention, concentration, perception, simultaneous successive background looks like this. بيربط بينها وبيعمل لها ربطة قوية جدا بينها وبين الأجزاء الوظيفية اللي موجودة في مخ الإنسان المسؤولة عن هذا الجزء. سؤال مهم جدا بيتبادر للناس: يا ترى إزاي إن أنا أستخدم الاختبارات النفسية العصبية؟ من أجمل وأشهر الاختبارات النفسية العصبية اختبار لوريا-نبراسكا نيوروسايكولوجيكال باتري. اختبار لوريا-نبراسكا نيوروسايكولوجيكال باتري أنا استخدمته من حوالي 5 أو 6 سنين فاتت في خلال بحث كنت مقدماه في الاتحاد الأوروبي. كنت بقول يا ترى هو أفضل كلوريا-نبراسكا نيوروسايكولوجيكال باتري ولا ال EEG؟ في الحقيقة أن التشخيص من خلال ال EEG كان البحث طبعا على عينة واحدة. العينة كانت من الأطفال والمراهقين، حوالي 30 شخص. هتسرب منهم في خلال العينة حوالي 5 أشخاص، ففضل عندي العينة 25. في خلال التجربة كان في تقييم من خلال ال EEG، فحص عصبي نفسي، وأيضا من خلال لوريا-نبراسكا نيوروسايكولوجيكال باتري. نتائج البحث كانت عبارة عن إن لوريا-نبراسكا نيوروسايكولوجيكال باتري هو الأفضل في التشخيص الدال على وجود اضطرابات في مخ الإنسان. في الحقيقة ال EEG بيديني فحص كأنه بيعمل سيرفي مثلا للمكتب اللي أنا قاعدة فيه حاليا، وللغرفة نفسها اللي أنا موجودة فيها، وللمبنى كله الموجودة فيه. فبيقول المبنى فعلا موجود في مكانه المفروض يكون موجود فيه، كل غرفة موجودة في مكانها المفروض تكون موجودة فيه، فعلا الغرف منظمة بشكل جيد، مستوى الكهرباء اللي بتمر بين الغرف سليم، مفيش أي interruption فيه، مفيش أي بؤرات صرعية موجودة في مخ الإنسان. طيب ولوريا-نبراسكا الاختبار أو البطارية اللوريا بتساعدنا على معرفة يا ترى الغرفة اللي أنا موجودة فيها حاليا المكتب منظم ولا فيه اضطراب، يا ترى ممكن يكون المكتب موجود في مكانه لكن الكراسي متكسرة والدنيا متلخبطة ومفيش علاقات جيدة بين المكتب ده والمكاتب الأخرى اللي حواليه. بيساعدنا بطارية لوريا على إن احنا نقدر نعرف يا ترى ايه مثلا علاقة الذاكرة السمعية بالقراءة. يا ترى في علاقة بين الذاكرة السمعية والبصرية بالقراءة والكتابة مثلا والحساب بالقدرات العقلية. بيدينا فكرة ان احنا نقدر نشوف اخبار مثلا الذاكرة الحسية، اخبار انواع مختلفة من الذاكرة والادراك. ممتاز جدا في ان احنا نقدر نعرف الوصلات اللي موجودة جوه مخ الانسان بتعمل بكفاءة ازاي. يا ترى مدى مستوى الخلل الموجود. طبعا هو ال EEG بيدي فيه خلل من عدم وجود خلل، لكن بطارية لوريا بتديني فكرة بتقولي مستوى الخلل قد ايه. يا ترى في خلل عميق، يا ترى متوسط، يا ترى بسيط. بدرجات بيقيسها البطارية. البطارية رائعة جدا في التشخيص، ممتازة جدا في تحديد مدى الخلل العصبي النفسي، القدرات العقلية المعرفية العصبية في الإنسان.
I'm Dr. Perry Horowitz, staff neuropsychologist here at JFK Medical Center, specifically over in the Center for Head Injuries. As I was just telling this gentleman, we have a very large staff of neuropsychologists, probably about 8 to 10 of us at a given time, depending on how many residents we might have. And I've been asked to speak today to do a general introduction of neuropsychological testing. The word neuropsychological may sound a little funny if you've never heard it before. You may be expecting high-tech equipment to be involved. Is this in your way? And you may be expecting needles and many of the medical type tests. As you saw from the discussion earlier today by Dr. Lau, there's lots of different technology that are being used in aiding the diagnosis and treatment of brain tumor. Neuropsychology isn't high-tech at all. It can be in a research setting, but in a clinical setting, you'll walk into my office and you'll see a desk with a good stack of papers on it, which are the tests that I'll be using, and also things like this. That's all. There's nothing will be hooked up to you, there will be no blood taken, no needles, no EEGs. Probably gonna have to keep doing this a few times. So, excuse me for that. Okay. So my goals today are to introduce this concept of neuropsych testing, give you a general sense of what it entails, what you might expect from it, and who'd have it.
It's my honor to do that.
Okay. So a general overview for what I'd like to discuss today is who should have neuropsych testing. What is it? What would you expect if you actually went for neuropsych testing? I'll give you a brief description of what the tests are like, and without giving you any answers to the tests here today, how the results can help the person that undergoes neuropsych testing. And of course, since we're here at the Brain Tumor Symposium, I'll discuss issues that are specific to working with brain tumor patients. Now, a neuropsychologist can pretty much just see anyone. I can see anyone in this room, whether or not you've had any type of neurological condition or not, because it's just tests. I can see how you do on those tests. Now, for the majority of you, I would expect that you would all perform within the normal range of expectation, just like with any blood test or blood sugar test. You don't want it to be too low, you don't want it to be too high, you just want to be within the normal range, and that's what the neuropsych tests are looking for. This is not testing to see if you should be a Mensa member. This is just to see if things are going okay, if you're performing as well as basically the average Joe who's out. And of course, at the end, I will open up the floor for question and answers. I'll also be available throughout the day if you don't get a chance to ask me the question here now. Who should have neuropsych testing? Your doctor may have mentioned neuropsych testing to you, and some people in this room may have actually gone through neuropsych testing, but your doctor will probably mention neuropsych testing to you if you've reported to them that you've noticed a change in what we call your cognitive functioning. Again, I'm starting to use some jargon terms here, so I'll try to explain them wherever I can. What is cognitive functioning? Anything that involves your thinking processes. So we're talking about things like your memory. We're talking about things like your language, your spatial abilities, your problem-solving abilities. Anything that involves your thinking, what your brain can do is the way that I like to present it. The thing that your brain allows you to do that allow you to conduct your daily task. So chances are your doctor may have referred you for a neuropsych test because you've reported to them a change in your thinking. You may have told them that you've had memory difficulties. You may have told them that you notice some trouble with speaking or understanding, or anything else that seems unusual, where you feel like your brain just isn't working for some reason. Perhaps it's not you who reported the difficulties, it might be a family member who reported the difficulties. And sometimes if the problem is noticeable enough, your doctor may notice the difficulties in their exam and refer you for neuropsych evaluation. Now, a neuropsychologist can see anyone, as I mentioned before, but generally we see people that have some type of neurological problem. So, I'm often being asked to diagnose things like Alzheimer's disease, or learning disabilities, or sometimes, in the case where there's a known neurological condition like a head injury or a brain tumor, you don't need a diagnosis. You know what the problem is, but you need to learn more about your cognitive functions. You need to learn more about how you think and what your strengths and weaknesses are at this time. So, generally, we try to see, in the ideal situation, we try to see folks that have brain tumors before they have any type of treatment. This helps us answer any academic question regarding what difficulties you're having, such as memory or language, related to the brain tumor, versus what difficulties you might have after treatment, like surgery, radiation, or chemotherapy. Now, very often, when you're diagnosed with a brain tumor, there's probably a big rush to get you into the operating room. You have lots of things to take care of in that small window of time that you might have. Could be overnight. You might have your surgery scheduled the next day if it's that emergent. So there's not a whole lot of time to say, okay, stop the presses. We're going to have neuropsych testing. We're going to spend a whole day in the office of a neuropsychologist. Let's hope she has an appointment open in her schedule, which generally we do not. And let's make sure that we know what's going on right now with the cognitive functioning before this person has surgery. And of course, that's not an ideal situation. We're not going to stop everything. Sometimes we can get pre-surgical neuropsych testing, but most often we do not, because the medical issues are much more important at that time. Now, the more important thing anyway is that you're tested after your treatments. So you don't need to worry if anybody in this room said, I didn't have a neuropsych evaluation before I went for surgery or chemo or radiation. That's okay. The more important thing is knowing where you're at right now, because the neuropsych evaluation is going to help you with what to do next. Okay. Oh, and one thing I also wanted to mention is another reason that you might have neuropsych testing is because you have some concern about your thinking now, and you're interested in maybe going back to work, or maybe going back to school, or anything else that you feel maybe you're concerned about, just being alone in your house, taking care of yourself. That's another reason to have a neuropsych evaluation, is because we can help you figure out what your risks might be if you go back to school or if you go back to work. And we'll try to figure out what's the nature of your job, to figure out if the difficulties that you're having now are really going to interfere with the work setting or the school setting. So we'll help you meet your goals in that way. So if a patient comes in my office and they say, having these memory difficulties, I just can't remember things, I'm going to ask them 1,000,001 questions to tell me, okay, well, give some examples of how you're having memory difficulties. Because so much of when the brain doesn't work, people perceive it as being a memory difficulty. Sometimes it's not just memory. Sometimes if you're having a difficulty, let's say problem solving, you may think that it's a problem with your memory, but it's really a problem with problem solving. And so it looks like you forgot something, but really the truth is you're not functioning because you haven't figured it out appropriately. So I'll ask you a lot of questions, but still I can't really get a feel for where your thinking is breaking down for you. So I have two options. I could come home with you and spend a week at your house. And I can follow you around everywhere, in the out of the bathroom. I can follow you around for 24 hours, and I can observe these difficulties that you're talking about. I can sort of assess the situation, figure out, okay, you didn't remember to, get your coffee from the kitchen, But maybe that was because your wife called you from the other room when you were on your way to the kitchen and that distracted you. That's completely efficient. I don't really have the time to go home with every single one of you. So what the neuropsych testing does is it allows me to get a sample of your behavior. I'm going to have you in my office, I'm going to spend the day with you, and I'm going to give you things to do. I'm going to watch you problem solve. I'm going to watch you memorize information. I'm going to observe if you make any mistakes in the things that I ask you to do. I get to see it for myself. So the neuropsych testing allows me to get a sample of what it is that you're reporting, whether it be memory difficulties or language difficulties, whatever it might be. As I mentioned before, neuropsych testing is not the high-tech stuff, as much as it might sound like a crazy term. It's not the high-tech stuff that Dr. Lau was talking about. It's things like this: puzzles and lots of papers, lots of questions and answers. Some people report that it seems a little like school. That's accurate and inaccurate. It's like school because you're being tested. It's inaccurate because you aren't expected to study for these things. And you're not expected to know every question the way that your teacher might expect you to know everything that she taught you in the history lesson. We want to just know if you're within this normal range of performance, which means that you're going to do well on some things and you're not going to do well on some other things. The utility of neuropsych testing is that it's not just my subjective opinion of how you do. I wouldn't make the same expectations of a 25-year-old who just graduated with a PhD from graduate school as I might for a 90-year-old woman who had 8 years of formal education. I just wouldn't expect the same thing on these tests from those two different types of people. The way that we accommodate that is that our tests are standardized. The publishers of our tests, and I'm not one of them, these are tests that are nationally used. These have been given to large numbers of the population in the United States. They have been given to 20-year-olds and to 30-year-olds, to 40-year-olds. They have been given to people of different genders and educational status. We have a general sense now from the standardization of how people should do. We want to know how Albert Einstein does, and we want to know how the average Joe does. And we have this information, we have numbers. And so we take your scores and we say, okay, this person is a man of 65 with 12 years of education. Let's see, look in the norms, let's see what we would expect this person to do on this memory test. So it allows us to not just make a subjective opinion on your behavior or your problems, but have actual numbers to compare your test scores to. And comparisons are always made with other people of your age and education. So you're never penalized in the sense for being of a certain age or not having enough education. As I mentioned before, I kind of want to give you a sense of what the testing is like without giving you the actual tests and the actual answers. If any of you are thinking about going for neuropsych testing, the worst thing that I can do is spoil it for you by giving you answers or showing you how to do things. So I want, if you're going for neuropsych testing, I want that to be a clean assessment for you, because if it spoils it, you might look better on a test than you really should, and you might not get the help that you need. So I'm going to make up a test right on the spot. Okay, for attention, if you think about what attention requires, let's just take the first 15 minutes that I've been talking. Chances are you probably haven't caught every single word or every single concept that I've said. That's because people's attention normally comes in and comes out. But, over a window of time, somebody really asked you to pay attention to something, you should be able to focus on a certain thing. So the way that I might measure attentional focus is I might play a tape, and I'll pretend that I'm the tape, and I'm going to rattle off a bunch of digits. 1, 8, 7, 6. And I'm going to ask you, don't worry, you don't have to do it, I'll be testing you. I'm going to ask you to tap your hand on the desk every time you hear the number 8. So if I do it pretty slowly, you can probably pay attention because it's not as hard to do 1, 8, 7, 2, 8. That's pretty easy. But what if I did this? 1, 8, 4, 6, 5. And I played that tape for you for 10 minutes. That's a little bit hard to do. And what we'll do is count up how many 8s you might have missed. And we'll compare that with what the average is for somebody of your age and education. So that's one way that we can simulate attentional focus. This might be important if somebody is planning on going back to school and you have a professor that talks as fast as I do. That could be a nightmare if somebody has attentional difficulties. So you want to make sure that that person is equipped to know what strategies to use if they're in a situation where, let's say, they're going to college and they have a professor that speaks rapidly. Perhaps there's something that can be worked out between the professor and the student, such as the professor giving them notes or allowing them to use a tape recorder that allows them to compensate for that attentional focus difficulty. Memory, it's probably easy to imagine how I test memory. And I basically give you things to remember right on the spot. I'm not going to ask you where you went to high school or where you went to college or what your teacher's names were, because that's all long-term memory. That stuff is in there, and that's not bothering you on a daily basis. The stuff that's bothering you on a daily basis is your short-term memory. Every single day of our lives, we learn new information. We learn that it's a new day. We learn that today is October 15th. Today, you might do a little bit more learning than you do on a typical day. You watch the news every day. That's new learning every single day. And what happens is that sometimes if you have a brain tumor or another neurological process, if you think of the brain as a computer, your processor might be on the fritz. So that new learning, it doesn't get well solidified in the brain, and that's why you lose short-term memory. Back when you were in high school and the names of your teachers and the street you grew up on, that got into the brain at a time where the brain was not on the fritz. Your processor worked just fine. But now, if the processor, the thing that makes the memory stick in the brain, is a problem for you, you're going to have problems with new learning and the day-to-day stuff. So remembering what was on the news last night. So I'm going to measure your short-term memory. And the way that I'll do that is I'm focused on learning how you do on verbal tasks and visual tasks. So verbal memory is memory for things that you hear, like today's lecture, or if I told you a story, or if you heard a story on the news. Visual memory will be memory for things that you see. So, in a testing office, I might give you a very long list of words for you to try and remember. I don't want to make it too easy for you, because easy tests don't give us any information. So, I did have a list here. Okay. So if you can imagine, I made up these words. These aren't part of a neuropsych test, so you don't have to worry about spoiling. I want you to hear the magnitude of how many words I'm going to ask you to learn. Here are the words I'd like you to remember. Cat, winter, fence, shoe, teacher, lime, library, grass, house, month, job, cotton, plate, phone, circle. How many did you get? And you're not expected. The first time I read you that list, I'm not expecting you to know all 15. Nobody does. Nobody gets 15. But at least we give you an opportunity to pick up ones that maybe you relate to or something. We probably, depending on your age, would only expect you to get maybe 5 of those 6 if I only told you that word once. But I might repeat that list over and over again to assess your learning curve, which gives me more information because it tells me if you can benefit from repetition. And that's good information you need to know. Okay, the way that I look at language, obviously in talking with a person, I'll get a sense of what their language skills are like. But on actual testing, I'll give them things to do. I'll put a whole string of objects in front of them, and I'll say, put the pencil on top of the card. See how well you follow directions. That will tell me about your language comprehension. A very commonly reported difficulty, especially if you have a tumor on the left side of your brain, is what we call word-finding difficulties or naming difficulties. It's when you look at something and you just can't get the word out. The word is on the tip of your tongue. All of us experience this occasionally, but sometimes if you have a problem in this department, you experience it very frequently. So you'll do something like, give me the thing. Okay, again, all of us experience this occasionally, but sometimes, especially if you have a tumor on the left side of your brain, you may experience this more frequently than not. So I can simulate this in the office and give you things like a cup and say, what's this called? What's that called that's in it? And see how well you can pull up the word on the spot. Now, spatial skills, sometimes you can get by, even if you have difficulties with spatial skills. But spatial skills come into play if you're driving, if you're a person who needs neat handwriting, or if you're an architect. And difficulty in spatial skills is very dependent on what it is that you do with your daily life. And if you're an architect, a tumor that disrupts your spatial skills is going to be devastating for you because it's going to interfere with work. If you have a job that doesn't involve spatial skills, it's not going to interfere with your work. A lot of people feel that they're weak in spatial skills to begin with. So one example I'll give you is, I could show you a picture of a pattern like this, and I can give you a few red and white blocks and just ask you to put them together. You can't see that. And ask you to put together so that they match the pattern in the picture. So that's one way of measuring spatial skills. Now, lots of people look at the blocks in the testing situation, they go, oh, I hate blocks, I've never been good at puzzles, I can't expect to be good with something like that. And that's true. This is not stuff that we do on a daily basis. We don't have any experience with this for the most part. But it's important if you were an architect. Yes?
Is that on a certain side of the brain? Spatial skills?
Yes, spatial skills tend to be mediated by the right hemisphere brain in an individual that's right-handed. If I have some time at the end of the day, I can go over why the doctors always ask you what hand you write with, right hand, left hand, foot you kick with, right foot, left foot, and why that's important to understanding how your brain is organized. In general, most people are right-handed, and most people have their brains organized in a fashion that left hemisphere of the brain is more important for language and verbal memory skills, and the right hemisphere of the brain is more important for spatial and visual memory skills. It's not as black and white in the real world. Those are some general guidelines that we know about the principles of brain organization.
Do you want questions at the end?
Sure. Go ahead.
Well, just, so if somebody is, say, in a room with a lot of people and they can't seem to sort of figure out where to go, that might be spatial issues?
It could be spatial, or is it, you specifically mentioned that there's a lot of people around. That could be that it's distraction, the noise, the sight. They might not be able to navigate where is the door. If, say, you're looking for the door, if too much stimulation, that might be competing with the attentional system, which, actually, I'll bring that up again in a little while. Actually, I'll bring it up again now. Okay, I'm going to bring in another one of our neuropsych jargon terms here again. Executive functioning. Anybody here know what executive functioning is or heard it before? Yeah, it's not something that people talk about unless you're in a neuropsych setting. Executive functions are important. Often when someone comes for neuropsych evaluation, they say, I'm having memory difficulties. It's often not memory per se, it's a problem with executive functioning. That's because as adults, we're expected to have intact executive functions. I'll explain this in several ways, some of which might help you understand the concept a little bit better than others. The reason they're called executive functions, this is the highest level of thinking that we as humans possess. This is what allows us to plan something. This is what allows us to organize ourselves. It allows us to do things at once, multitasking. It allows us to regulate ourselves. These are pretty sophisticated things that our brain does. It's a lot more sophisticated than following a direction like put the black square on the red square. That's pretty simple. Now, you can think of executive functions are the things that you would want the CEO or the executive of a company to have. That's why they're called executive functions. It's the person at the top that oversees all the things that are coming in from the environment, all the knowledge. Other people like to describe executive functions as being the conductor of an orchestra. In an orchestra, you have a piano section, you have a flute section, you have a horn section. Now, all these things work very well on their own, but the coordinator, the conductor, needs to be there, otherwise everything's going to be a big mess. So it's the person in charge. If you imagine a little executive in your brain, it's the person who's really in charge of the highest level of thinking. Okay, and you mentioned multitasking. In that situation where the person might be seeking the front door, if you're having multitasking as a problem, the distraction of the people or the noise in the environment makes that situation more of a multitasking situation. Not only does this person have to find the front door, but this person also has to find out the information that's coming in that's distracting them. So you got two things going on. So again, it's a high process. And often these are disrupted with tumors that can be anywhere in the brain. There's such high-level processes that you pretty much, I like to think that you pretty much need a whole brain to take care of these things. Now, in my clinical practice, and I don't want you to quote me on this, this is just one of those things that you learn in working with lots of patients and understanding what makes sense to people and what doesn't. So I'm going to give you a completely inaccurate, that you won't find in any textbook, way of thinking of executive functions. The way that I like to present executive functions in terms that people can understand, it's the things that make adults different than children. You would not expect a 5-year-old child to plan a picnic. You would not expect a 5-year-old child to organize themselves. You certainly wouldn't expect them to try to multitask and do 2 things at a time. The reason that we have executive functions is that through adolescence, our brain continues to grow, especially the area in the front called the frontal lobe. With that growth comes the capacity to do these higher levels of thinking. So I've found that people understand executive functions in the terms, like I said, you won't find that in any textbook, but that's the way I like to think about it. It's the things that make adults, the things that adults have the capacity for that children do not. That's the way to think about it. Did you have questions?
So in a testing situation, would you not give that part to a child?
Actually, there's minimal testing that you do for young children. Because the brain grows through adolescence, you generally start to see executive functions start coming into play around age 8, age 9, age 10. Of course, development is different with kids, just as growth spurts happen at different times. Same thing, the growth spurt with how mature their brain gets. You do start testing that probably around, let's say, like age 8 or 9. You're expecting the children to get a little bit better. Like the general rule of thumb is that by the 2nd grade, you expect a child to be able to sit still. And that's an executive function. That's the person at the top. That's the executive saying, calm yourself down. Okay, because now you need to regulate yourself. Self-regulation and controlling impulses. Okay, now we can, go ahead. Yes, go ahead.
How do you test that in an adult?
Actually, this is one of the tests of executive function. This is a test of planning. Now, as best as I can give you a picture. Well, let me start. Okay, I'll show you a picture of this. Okay, I don't have the picture with me, but I showed you a picture of this, and I left it in front of you. And I messed around with some of these. Let me see if I can get a little bit better. Okay, I presented the board to you this way, and I said, okay, I want you to get back to the original starting position that I have the picture of, but you can only move one piece at a time, and you all can never place a big piece on top of a little piece. So I'm giving you some rules, and you have to sort of figure out how to best plan that out. Now, your goal is always to try and, on this test, get to the solution with the fewest number of moves possible. If you sat there all day, you can probably figure it out, but you want to try to get there using the fewest number of moves possible. So that's a test of planning. In terms of organization, we simply have to give you a mess of something and ask you to organize it. Multitasking is also easy. I'm going to ask you to do 2 things at once and see what your accuracy level is like with that. Okay, the self-regulation stuff, that more comes from the behavioral observation. I'm going to know if you're impulsive because you're going to jump into the test before I say go. And error monitoring, what that is, again, kids, they make mistakes. They might, they trip over something because they're just not monitoring their environment very well. They don't have that sophistication of attention skills. As adults, if, we are looking for something, we generally can find it if it's right in front of us. But sometimes the error monitoring system goes awry with neurological problems, and you might not find something immediately. It's right in front of you because your attentional system is taking in that information. And error monitoring also is you make a mistake, and in your daily life, you make a mistake, you just correct it. You don't think about it, you just move on. But if you have a brain tumor and you're making those types of mistakes more frequently, you're going to notice difficulties with error monitoring. You're not going to pick up on your errors as well if that's a source of the difficulty for you. Now, we also do have tests, which is generally in the form of questionnaires regarding personality changes, emotional changes, and of course these things are important when talking about your recovery. But you don't really need to focus so much on tests for these things because this is something that we can generally accomplish during a clinical interview with the patient and their family. And personality changes and emotional changes, emotional lability, which is easy to cry, quick to temper, or emotional dulling, so the person becomes sort of flat, really doesn't show a whole lot of emotion. These things can occur with any type of neurological dysfunction, including a brain injury. Okay.
Do you see a lot of going from the dullness to the lability?
Well, that's a general problem. Well, it could be mood swings is really how to conceptualize that.
Is that common?
It depends on the location of the tumor and depends on everything else. Who you were before you had the tumor, it's very individual. Okay, so how can these results be helpful for you? These results will give you a sense of your cognitive strengths and weaknesses. We all have cognitive strengths and weaknesses, but when we're talking about people who actually come into a doctor's office to say, having memory problems that are affecting my daily life, generally I'm expecting to find some areas of weakness, significant weakness, not just, you're better at it, just naturally, or weak at it naturally. Once you have this knowledge of knowing your cognitive strengths and weaknesses, this is the start for your next step. Your next step may be rehabilitation, it may be getting back to work, it may be getting back to school. Awareness is the key to improvement. And that is probably the biggest take-home message I can give you today. Knowing more about how your brain works. This is how to do it, neuropsych testing, to know how your brain works and where things fall apart for you if you're having difficulty. Awareness, you need to have that awareness in order to fix it, or at least get around it. If you take a car that just suddenly doesn't work, and you open up the hood, unless you find what the problem is in that car is not going to drive again. If you don't know what's wrong with it, it's not going to fix itself. You need to figure out what the problems are so that you can tailor your environment to trying to get around those difficulties that you're having. And the goals typically, make sure my time, considering that they're clapping next door, the goals typically are for rehabilitation. Your therapist needs to know what your weaknesses are too. If you have a difficulty with language comprehension and you're working with a physical therapist, that physical therapist is going to need to keep in mind that he or she needs to make sure that you understand what it is they're asking you to do. Because otherwise they might just conclude that you can't do that movement that they're asking you to do. But really the truth is that you don't understand the language. So maybe that physical therapist needs to keep in mind that they need to show you what it is they want you to do. They need to know to get around your weaknesses. Often, neuropsychologists are asked to help with future planning. Reading and language comprehension deficits can be of great concern to families who need to plan for their future, because the future planning, especially financial and medical matters, tends to involve a lot of paperwork and understanding of the risks and benefits of undergoing certain treatment procedures. You don't want, if let's say a family member is not around, you don't want some doctor or social worker to plop a set of papers in front of someone you know is having reading comprehension difficulties and say, sign on the dotted line. Everybody in the patient's care needs to be aware if you're having reading and language comprehension difficulties, because if you're being asked to sign something on the dotted line, you want to make sure that you understand it and that people take the extra steps to help you understand it. Okay, now issues specific to the brain tumor population. Now generally you'll work with your physician. And first thing you generally want to know is the tumor benign or malignant? And that is important for your medical treatment. However, a benign tumor to a neuropsychologist doesn't mean anything, because the question to us is, where is it? Doesn't matter if it's benign or malignant. If that benign tumor is in a place in your brain that's very important to your daily functioning, your quality of life is going to be very affected. So even a benign tumor in the wrong spot may cause you a lot of difficulties. The good news is that with brain tumor, unlike something more diffuse like Alzheimer's disease or traumatic head injury, the good news is that the brain tumor may only affect specific functions within that area of the brain that's affecting. Generally, if a tumor's in one hemisphere, the other hemisphere generally works okay, as long as nothing's going on in that hemisphere too. So you may be at risk for cognitive difficulties because of where the tumor is. You're also at risk for additional cognitive difficulties, or the onset of cognitive difficulties, with treatments that come with treating a brain tumor. Now, obviously, you need to make treatment decisions that are best medically. But people often have questions for us whether or not the treatments have had some, what we call secondary or iatrogenic effects, meaning that they're cognitive difficulties that come from the treatment, not the actual tumor itself. Obviously, surgery. Sometimes you have a negative effect from surgery because the physician needs to take out areas of the brain that are still working for you. And as Dr. Lau had presented, they try to avoid areas that control language and motor skills, and they do it to the best of their ability. That's the negative side of surgery, is that sometimes they might have to take out good working tissue. However, if you have a tumor that is growing within the confines of the skull, that's a pretty confined space. The bigger that tumor grows, the more the rest of the brain gets pushed aside. And you can think as the brain is being squished, and you can see that on an MRI scan. You sometimes will see improvement with surgery in those cases when the brain is being squished like that. Because when they take the tumor out, the brain gets unsquished, and then the rest of the brain starts to work again. So surgery can go in one of two directions. In some cases, could go in both directions in the same person to allow for improvement and perhaps some additional cognitive difficulties. And briefly, radiation, especially if it's whole brain radiation, may cause you some cognitive difficulties. That's because the radiation sometimes can attack the connections between the brain. So if the brain can't connect with itself quickly, you might see some cognitive difficulties affecting your life. And generally we'll see attention and executive dysfunction, particularly when you have whole brain radiation versus partial radiation. Now, there are conflicting studies, but some studies do show that after having radiation, the brain can fix itself to some degree with these connections. They're called white matter connections. And these difficulties from radiation may resolve within the course of a year. But there are some conflicting studies with that, yes.
Do those studies relate to the whole brain or?
Mostly to the whole brain studies. Okay, and this is my last slide. And then I can open it up for questions if I have a few minutes left. Also, there's chemotherapy. Now, chemotherapy is a little hard for us to make conclusions about because chemotherapy is usually the last step. So if you're giving somebody a neuropsych evaluation at the stage where they've already done chemotherapy, they've also already had the brain tumor, they've already had the brain tumor removed, they've already had radiation, and now they have chemotherapy. So academically, you might not be able to say, okay, this cognitive deficit due to the chemotherapy. But the rule of thumb is that generally the more aggressive the chemotherapy, aggressive being defined as the medical treatment that you'll work with your physician, the more likely you might have some cognitive difficulties. That's because, as we know, chemotherapy doesn't just attack bad cells, it also attacks good cells as well. So the more aggressive the chemotherapy, the more likely you might have some cognitive difficulties as a result. Now, I throw these in here because I think that this is also a huge take-home message that I want to give you. Whereas I might be presenting a little bit of a bleak picture regarding your risk factors for cognitive difficulties with brain tumor treatment, there are some effects that may be depressing your cognitive function that are reversible. So whereas some of these other things might not be so reversible, there are a few things that are reversible which could be impacting your day-to-day life. If you have severe clinical depression, I'm not talking about what your expected adjustment to living life with a brain tumor and accepting the diagnosis and experiencing your changes in life. If you have depression at the level of severity that you cannot get out of bed, it affects everything that you do. You might have your eating affected, your sleeping affected. You may even feel like taking your own life at times. That's the level of depression that I'm talking about here, which could have an effect on your cognitive function. We could call this an excess burden. So on top of all the tumor and the treatments and difficulties you might be having because of that, you put an additional burden on top of that because even a physically healthy person who's experiencing that level of depression is going to have memory and concentration difficulties because of the depression. So if you have all these things medically, throw severe depression on top of it, it may be an excess burden on your cognitive functioning. Good news about depression is that unlike some of these other things, potentially reversible with psychiatric or psychological treatment. Also, if you're having sleep disturbance, whether it be for medical discomfort or because of depression, it is very hard for a brain to concentrate when it's exhausted. So if you're having any sleep difficulties, don't just discount them. Don't just say, okay, when I go to my doctor, I'm going to report the important things. I'm not going to tell them about these sleep difficulties. Mention the sleep difficulty because that could be also adding an excess burden to what you're already dealing with. Again, treatment decisions will always involve balancing the risks and benefits of each treatment. This is not a lecture on what not to do brain tumor treatment. Your doctors and you will always try to maximize the quality of your life and generally make decisions based on what increases your prognosis and survival. Okay, so I hope that this was a good introduction for you to get a feel of what neuropsych testing is about and what our goals would be. And I'll open the floor for some questions. We have a few minutes. Yes?
Yes, I've already had this, and I found
Yes.
it quite helpful.
Yes?
But in a support group I belong to, there's been a discussion recently about testing brain tumor patients all in one day. People already dealing with some depression, some chronic fatigue maybe.
Right.
And by the end of their non-functional.
Right.
Their tests are not accurate.
Right. Okay. Well, there's multiple ways to help for that. Okay. Yes. Some people do testing all in one day because of the constraints. You know, sometimes there's transportation issues, and you want to get it all done in one day. I'm actually one of those neuropsychologists that's in favor of breaking up the testing in 3 days. But I tell the patient at the beginning of the session, I have to leave it up to their judgment. And I say, it is up to you to tell me if you need a break. And it's up to you to tell me if you're feeling too fatigued. Because if you're giving me, it's garbage in, garbage out by the end of the day, you're getting nothing but garbage, that messes up what I'm looking for. Because it's going to make you look worse on the test than you really are, and your rehab goals are going to be all wrong. And your therapists are not going to understand things they're supposed to understand. So in my practice, I ask the patient to let them be the judge. And if they say, you know what, I need a break, take a break. And I say, do you need a longer break? Do you need to go home and sleep on it? They can do that too.
The second question I have, one of the patients in the group, a young man whose mother was his caregiver, and he's refusing to go for his second, maybe third neuropsych testing because he feels that it makes him feel stupid.
Right.
He goes home very depressed. He cries.
Can't force anybody. You can't force anybody to take neuropsych tests. And another reason, even if you can get them into your office, there's no point forcing somebody to take neuropsych tests because, as you can imagine, you need to be motivated to do well on the test. You need to have a good understanding of what you're there for. If you're going to sit there like this all day, you know what? I'm going to agree with you and say, you know what? You don't need neuropsych testing because you need to concentrate in here and need to really give your best effort. If you're not going to give your best effort, your testing is not going to show anything that's useful. So
sometimes it's not their choice. Sometimes
but with neuropsych testing, you can't.
People telling you, well, you have to do this once a year to keep your benefits coming.
You know what? I don't want to see anybody that doesn't want to be there because they're not going to give me any valid results. And if they don't give me valid results, then I'm not doing my job. I'm making poor judgment. I'm making poor judgment on, and I'm putting it on paper. It's not like a blood test that you can sleep. You can sleep when somebody takes your blood. You don't need to be there. Neuropsych testing, you need to be alert, you need to be awake, and you need to be at your best in order to get an accurate performance. I'm sorry, you had your head for a while.
For pediatric neuropsych
Yep.
testing for school issues, for IEPs and things like that, are there set tests? Are they different for adults?
They're different. They're different tests for children, and they are norms on children. Generally, testing for school-age children is generally, I confine it to the context of school day. Kids generally don't do much after 3 o'clock, for the most part. So if I do need to continue testing after 3 o'clock, schedule it for another day.
But what if a child already has disabilities or vision impairments, that kind of thing, then is there can you break it up even more?
You wouldn't need to break it up more because of visual impairments. You just wouldn't. You'd actually be giving less testing because you'd be only testing through an auditory modality.
How frequently does a patient typically come back for testing? So, is there some trigger that would say, oh, this would be a good opportunity?
Well, for anything that's progressive, we do recommend that you come back so we can chart your progress. Many people come back with their own knowledge. They just want to know if they're doing better. And having that baseline, having those numbers of how they scored the first time, gives me a way to really definitively say you're doing better. Or these things may be getting worse. How's it go? Okay, very good. I will be available for questions. Actually, I'm available right now if you have additional questions.
أهلا بحضراتكم تاني بعد الفيديو. أتوقع أن الفيديو كان واضح جدا في شرح إيه هي الاختبارات النفسية العصبية، إزاي بنستخدمها، إيه هي الجوانب اللي بتستخدمها، إيه هي النقاط اللي بتستخدمها. بوعد حضراتكم إن إحنا هنخصص مرة لوحدها تكون تماما على شرح اختبار لوريان براسكا نيورو سايكولوجيكال باتري تفصيلا، وإزاي نستخدمه كأخصائيين نفس عصبيين cognitive neuropsychologist. خلينا دلوقتي نتنقل على الخطوة اللي بعدها، نماذج لحالات من كتاب الدماغ. صراحة كتاب الدماغ هو من أفضل الكتب اللي قريتها فيما يخص تطوير البنية والأداء. الكتاب بيعرض مجموعة من الحالات، الكتاب كبير حوالي 360 صفحة زي ما حضراتكم شايفين. بيعرض لنا مجموعة من حالات قدرت إن هي من خلال اللدانة العصبية إنها تغير حياتها. الكتاب بيعرض حوالي 18 حالة تقريبا من الحالات، يمكن أكتر، من خلال إن الناس دي اتعاملت مع لدانة المخ، اتعاملت مع إن المخ بلاستيسيتي، إن المخ بتاعنا قابل للتشكيل، إن المخ بتاعنا يقدر يؤدي الوظائف بأكتر من شكل مختلفين. قدرت إن هي تتعامل مع مخنا بطريقة مختلفة. بوعد حضراتكم إن شاء الله إن السبت بعد القادم، إن شاء الله السبت اللي بعد القادم هيكون موعدنا مع السبت بعد القادم الساعة 10 صباحا بتوقيت مكة. موعدنا إن شاء الله هيكون مع كتاب الدماغ. يا ريت حضراتكم تحاولوا تنزلوه PDF، هو متوفر على الإنترنت. يا ريت حضراتكم تحاولوا تنزلوه PDF، لأن إحنا هنستعرض الحالات اللي فيه حالة حالة ونتكلم عنها في إطار نظري وفي إطار ما استعرضه الكتاب عمليا من خلال هذه الحالات. خلونا نتنقل بشكل سريع جدا إلى ملخصات الأبحاث. النهاردة معانا مجموعة من ملخصات الأبحاث الرائعة. أول ملخص بحث فيهم هو جانبان لمعالجة الكلام. ملخص البحث بيقول: كان يعتقد منذ فترة طويلة أن وظيفتي فهم وإنتاج الكلام مرتبطتان، لكن الآليات العصبية الكامنة وراء هذا الارتباط ومسألة تحديد جانب الدماغ لأي من الوظيفتين بقيت مجهولة. وهنا يكشف بيجان بيسيران وزملائه أن التحولات الحسية الحركية تحدث بشكل ثنائي، وبالتالي هم يبرزون وجود نظام حسي حركي ثنائي للكلام يناقض هذا العمليات اللغة عالية الرتبة التي تتجه إلى جانب نصف الدماغ الأيسر. زي ما حضراتكم شايفين في الرسم التخطيطي اللي أنا عاملاه، هو جزء منهم عبارة عن إن حضرتك بتستقبلي اللغة، مجرد إن أنت بتفهمي اللغة بتجيلك اللغة فأنت بتفهميها. الجزء الثاني هو إنتاج الكلام. مجرد ما احنا بنسمع الشيء فبيروح لمنطقة فيرنيكا في الجزء الصبغي الجداري في مخنا، وبيبتدي انه يحصل لي فهم للغة المسموعة وتترجم إلى جزء من إنتاج الكلام في منطقة بروكا في الجزء الجبهي من مخ الإنسان، ثم تنتقل إلى القشرة الحركية التي بدورها تنقل الفكرة أو الكلام أو الفهم أو الإنتاج إلى جذع المخ الذي يعطي الأوامر إلى الشفاه واللسان والبلعوم والحنجرة والتنفس. ده مخ الإنسان بالظبط. دي منطقة بروكا الموجودة في الجزء الفرونتال الجبهي، دي منطقة فيرنيكا الموجودة في الجزء الصدغي. جالي في العيادة النفسية حالتين. الحالة الأولانية كانت لحالة طفل عمره حوالي 4 سنوات. الطفل كان اسمه محمد. نقول له: محمد لو سمحت هات القلم. يروح يجيب القلم من مكانه بالظبط. ايه اللي انت بتسويه بالقلم؟ يمسك القلم ويبتدي ان هو يكتب بيه، او مش يكتب، يعني يعمل شخبطات، دوائر، خربشات. نسأله: اسمه ايه؟ يقول مروحة، يقول ساعة، يقول شيء، كل مرة يقول حاجة مختلفة. محمد كان عنده مشكلة في إنتاج الكلام وليس في فهم الكلام. كان الخلل اللي عنده في الفرونتال لوب في جزئية إنتاج الكلام. جالي حالة تانية في العيادة النفسية، كانت عبارة عن بنت عمرها حوالي 16 سنة. البنت كانت بتعاني من مشكلة في منطقة فيرنيكا، في منطقة فهم الكلام. فهم الكلام بمعنى ان البنت نفسها كانت تقعد قدام التلفزيون مش فاهمة اي حاجة من الكلام اللي بيتكلم تماما، ما تقدرش تفهم على اي شخص من الاشخاص المحيطين بيها الا والدتها. كانت والدتها بتكلمها باسلوب معين وبطريقة معينة، كانت الوحيدة اللي بتقدر تفهم بشكل عام والدتها عاوزة ايه. اي حد عاوز يتواصل معاها لازم كان يكلم والدتها، والدتها هي اللي تحاول تترجم لها الموضوع ايه اللي احنا بنتكلم فيه. البنت كان عندها خلل في الجزء في منطقة فيرنيكا، في الجزء الصدغي الجداري في مخها، في الباحات القشرية وتحت القشرية. كانت المشكلة ديب ومحتاجة تدخلات نيوروسايكولوجية. خلينا نروح للبحث اللي بعده، وهو بحث لطيف جدا بيتكلم عن التجدد من خلال إعادة البرمجة. يا ترى احنا نقدر نعمل إعادة برمجة لخلايا الكروموزومات الصبغيات اللي عندنا؟ البحث بيتكلم على كده، بيقول ان الصبغيات او الكروموزومات الحلقية هي شذوذ بنوي غالبا ما يرتبط بالعيوب الخلقية والإعاقات العقلية وتأخر النمو. اشتق يمن كان وزملائه خلايا جذعية مستحدثة متعددة القدرات IAoPS من خلايا المرضى الليفية، تحتوي على صبغيات حلقية بمحذوفات كبيرة. وجدوا أن الخلايا المعاد برمجتها تفقد الكروموزوم الشاذ وتكرر النظير من خلال آلية تعويض للصيغة الصبغية الثنائية من أحد الأبوين، وبالتالي فلدى الخلايا الجذعية المستحدثة متعددة القدرات IPS قدرة فعلية لإزالة الكروموزومات التالفة ذات بنى حلقية ومحذوفات تمتد إلى مئات الملايين من القواعد النيتروجينية للحمض النووي. ويرى الباحثون أن إعادة برمجة الخلايا قد تخدم وظيفة مختلفة جدا عن الوظيفة المألوفة بوصفها وسيلة علاج كروموزومي تعكس فقدان الوظيفة المشترك عبر جينات كثيرة بخلايا ذات تشوهات جينية واسعة النطاق متورطة في البناء الحلقي. البحث زي ما حضراتكم شايفين هو بيخدم لنا موضوع التجدد من خلال إعادة برمجة الخلايا. بيثبت لنا إن في قدرة للخلايا أو الصبغيات الكروموزومية على إن هي تعمل إزاحة أو تحذف بشكل كبير جدا الخلايا المريضة الليفية الموجودة عندها، وإنها تعمل إعادة تجديد أو إعادة استنساخ للخلايا الجيدة، الخلايا الجيدة الخالية من الاضطرابات. البحث اللي بعديه بشكل سريع جدا 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 بيتكلم على علاج إصابات الدماغ لحديثي الولادة. يا ترى احنا نقدر ان احنا نعالج إصابات الدماغ للأطفال حديث الولادة؟ موضوع شائك جدا اتكلم فيه كتير من الناس، خصوصا ان إصابات الدماغ لحديث الولادة بتنتج عن أسباب متعددة، سواء كانت داخل غرفة الولادة، في الغالبية داخل غرفة الولادة، أو ما بعد الولادة بشكل مباشر. البحث بيتكلم عن زيادة معدلات بقاء الأطفال الخدج أحياء. ازدادت كذلك الإصابات باضطرابات النمو العصبي المزمنة لحديثي الولادة، وتعد إصابة ارتشاح المادة البيضاء شائعة في الأطفال الرضع المولودين مبكرا مع إصابات الدماغ لحديث الولادة، لذلك جزئيا نتيجة لفشل نضوج سلائف الخلايا الدقية قليلة التغضن. وهنا عزز فيتوريوجالو وزملائه تأشير مستقبل عامل نمو البشرة EGFR في سلائف الخلايا الدقية قليلة التغضن في نموذج إصابة بارتشاح المادة البيضاء، ووجدوا زيادة في الانتعاش خلويا ووظيفيا بعد الإصابة، انخفض موت الخلايا الدقية قليلة التقدم، وازداد توليد الخلايا دقية قليلة التقدم جديدة بالعلاج. يحدد هذا العمل إشارات مستقبل عامل نمو البشرة هادفا علاجيا محتملا لعلاج الأطفال الخدج بعد إصابة بارتشاح المادة البيضاء. يعتبر البحث بيدينا أمل تاني جديد جدا لعلاج إصابات الدماغ الحديثي الولادة المصابين بارتشاح في المادة البيضاء في المخ. أمل جديد لينا وكثير من الحالات اللي مستنيين هذا العلاج. يا ترى تتوقعوا إن خلايا مخنا ممكن إنها تشيخ؟ طيب تتوقعوا إن عضلات الإنسان ممكن توصل لمرحلة من الشيخوخة؟ البحث اللي معانا النهاردة بيتكلم على عندما تشيخ العضلات. هي إحدى الخصائص الحاسمة لوظائف الخلايا الجذعية لدى الثدييات الناضجة، هي القدرة على البقاء في حالة سكون لفترات مطولة، الاستجابة عند نشوء الحاجة إلى التجدد، فقدان كتلة وظيفية عضلية هيكلية. سمة مشتركة للشيخوخة المتقدمة لدى البشر ترتبط بفقد القدرة على تجدد الخلايا الجذعية للعضلات الهيكلية المعروفة بالخلايا الساتلة. أظهرت بورا مونيوز وزملائها أن الخلايا الساتلة التي تمر بمرحلة الشيخوخة تمر بانتقال نهائي من السكون إلى حالة ما قبل الشيخوخة، مرتبطة بزيادة تعبير بروتين P16INK4A، وهو بروتين كابح للورم تم تحديده مؤشرا على الشيخوخة. وظهر أن كبت بروتين P16INK4A خلال فترة الرشد يحافظ على الخلايا الساتلة في حالة سكون قابلة للانعكاس، مما يتيح تجدد العضلات. يختل تنظيم بروتين P16INK4A في الخلايا الساتلة للبشرة المتشيخة، يفتقد إمكان تجدد العضلات. هم اكتشفوا حاليا البروتين المسؤول عن تشيخ العضلات، بيحاولوا يعملوا كتير جدا من الأبحاث عليه في الفترة الحالية. البحث حديث ونأمل في المزيد من هذه الأنواع من الأبحاث. بسرعة جدا 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 هنروح إلى البحث التالي، وهو تحليلات جينوم لأورام البطانة العصبية. البحث بيتكلم على إن عرضت مجموعة بحثية في دورية نيتشر مؤخرا تحليلات جينوم مستقلة لأورام البطانة العصبية. هي أورام تحدث بجميع أنحاء الجهاز العصبي، لكنها أكثر شيوعا بمؤخر أدمغة الأطفال. عثر ماك وزملائه على معدل تطفر إجمالي منخفض، ولم يجدوا طفرات مهمة متكررة في 47 من أورام البطانة العصبية بمؤخرة الدماغ، لكنهم ميزوا مجموعة أورام الحفرة الخلفية P، وهي مجموعة فرعية توجد غالبا لدى الرضع، مرتبطة بسوء المآل بالنمط الظاهري الممثل لجزر CPG، مناطق جينوم تحتوي على تكرار عالي من مواقع سيتوزين فوسفات جوانين. وظهر أن هذه المجموعة الفرعية عرضة لمختلف المركبات التي تستهدف تعديلات لا جينية، بما في ذلك مثبط EZH2 الذي أظهر كفاية في نموذج فأر أجنبي الطعم. كذلك عثر باركر وزملائه على جين الاندماج C11 or F95 RELA في حوالي 70% من الأورام فوق الخيمية، لكن لم يجدوا في المجموعات الفرعية الأخرى لأورام البطانة العصبية ذلك الجين. ينشأ اندماج الجينات من خلال عملية كروموسيسيس، وتؤدي إلى التعبير عن بروتين الاندماج الذي ينشط تأشير NFKP تكوينيا. في نموذج الفأر يؤدي التعبير عن جين C11 or F95 في خلايا جذعية عصبية إلى تشكيل أورام الدماغ. وتحدد هذه النتائج أن تأشير NFKP هدف علاجي محتمل لدى المرضى بهذا النوع من ورم البطانة العصبية. آخر آخر شيء هنختم بيه اليوم بشكل سريع جدا 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 هي نصائح بتقدمها لنا الكاتبة كين في مجلة ناتشر عن أبجديات المقابلات. كين بتقول لنا إن هناك مجموعة من الأسئلة الغريبة اللي ممكن تقابلنا في خطوات النجاح للمتقدمين لوظائف البحث العلمي. بتقول لنا إن عندنا موقع في منتهى الروعة ممكن إن احنا نروح نشوف فيه بعض الأسئلة الغريبة اللي ممكن حضرتك أو حضرتك تتسأليها في حالة المقابلات. ده الموقع اللي حددته كين .com/ELNMCP. كين بتقول لنا إن عندنا مجموعة من الأسئلة زي مثلا ما هو مقالك المفضل في صحيفة نيويورك تايمز الصادرة اليوم، زي مثلا كيف يمكن أن تصف نفسك، زي مثلا ما هي خطتك للأعوام الثلاثة المقبلة، اللي بعديها ما هي وظيفة كل من والديك. مش دايما بنقابل في المقابلات الشخصية بعض الناس اللطاف، بعض الأحيان بنقابل ناس بيكونوا مرة طف، بيكونوا مرة سيئين. ممكن إن احنا نتعامل مع الموضوع بشكل هادي جدا. كين بتنصحنا بإن احنا نعمل تقصي المعلومات من أجل المقابلات. بتقول لنا تقدروا تعملوا سيرش على المكان اللي انتوا رايحين تقدموا فيه للوظيفة اللي انتوا هتعملوا فيه المقابلات الشخصية، تقدروا تعرفوا عنه بعض المعلومات من خلال شبكات التواصل الاجتماعي. وبتدينا كمان موقع في غاية الجمال يقدر يساعدنا على ده، اسمه jobitorIAL.com أو www.glassdoor.com. كين بتقول لنا إن الموقعين دول فيهم بعض الآراء لبعض الموظفين المجهولين من الشركات والمؤسسات اللي بيتكلموا عنها. نقدر إن احنا ندخل ونعرف بعض الحاجات عن الشركة مع الانتباه إن ده بيعكس صورة شخصية عن الشركة وليست الصورة الكاملة. بتنصحنا بالدخول لمواقع اللينكد إن، لمواقع التواصل الاجتماعي، لمواقع تويتر، لمواقع الفيسبوك، لجوجل بلس والمدونات عشان نقدر نعرف مور عن الشركة. آخر شيء بتنصحنا بيه كين هو البقاء هادئا. غالبا ما يعتمد الفوز في لعبة المقابلة على البقاء هادئا ربط الجأش. بتنصحنا كمان نصيحة مهمة جدا، نواجه الأفكار المثبطة نفسيا. إن لما حضرتك تقعدي تفكري أو حضرتك تفكر بشكل سلبي فتقول لن أكون أبدا مستعدا بدرجة كافية لهذه المقابلة، ستكون كارثة مثلا في حياتي إذا ما قدرتيش تجاوبي على سؤال من الأسئلة. بتقول لنا لا، مفروض إن احنا نجهز مجموعة من الأفكار الإيجابية، زي إن أنا هكون مستعد وإن أنا هكون ممتاز وإن هي هتكون أفضل مقابلة. طيب في حالة إن احنا ما قدرناش نجاوب على سؤال بشكل احنا شايفينه ساتسفايد لينا، بتنصحنا كين بإن احنا واحنا بنعمل خطاب للشركة نشكرهم فيه على المقابلة من خلال الخطاب أو بريد إلكتروني، إن احنا نرسل فيه إجابة على السؤال اللي احنا حسينا فيه بقصور في الرد عليه. آخر حاجة اليوم هنختم بيها النهاردة، أتمنى يكون اليوم مفيد بالنسبة لحضراتكم، أتمنى يكون السمينار مفيد، مزيد من مشاركات حضراتكم، مزيد من حضور حضراتكم. سعيدة جدا بوجودكم معايا النهاردة. بتمنى ان هو يكون افادكم فعليا. خلينا نختم بالكلمات دي: الشمس تشرق كل يوم في السماء، افتح بابا في قلبك لتنير ايامك. عندي سؤال او تعليق في نهاية اليوم، حاولوا تجاوبوني عليه من خلال الايميلات او الفيسبوك او التويتر. يا ترى احنا خلقنا ليه؟ لإعمار الكون. ايه معنى إعمار الكون؟ ايه هدفك؟ ايه خطتك؟ انت بتعملي ايه في الدنيا؟ انت بتعمل ايه؟ عندك ايه بتعمله؟ ايه الهدف اللي انت عايش عشانه؟ يا ترى اهدافنا ايه؟ يا ترى خططنا ايه؟ ازاي ان احنا نخطط لحياتنا؟ ازاي ان احنا نحط لنفسنا هدف؟ الناس بتعيش علشان تاكل وتشرب وتتكاثر زيهم زي الانعام، ولا الناس بتعيش علشان ايه؟ هدفك في الحياة مستنيين من حضراتكم ردود على السؤال: ايه هو هدفك او هدفك في الحياة؟ ليه انت موجود؟ ليه انت عايش؟ عايش ليه؟ بتعمل ايه؟ مستنيين من حضراتكم ردودكم تعليقاتكم على ايميلنا i.psychological science